local school. I'm an infectious diseases clinician and also have an interest in global health issues. And it's a pleasure to be here today, this afternoon, to chair this meeting. So I'd like to welcome you all to this roundtable. Thanks everyone for coming. And we're hoping it's going to be a very sort of interesting, stimulating discussion around TB, and perhaps from a more different perspective from the usual debates around TB. So just as a way of background, TB remains a major global health problem. And so in 2012, there were an estimated 8.6 million people who developed TB, and 1.3 million of these died from the disease, including 320,000 people who were co-infected with the HIV, human immunodeficiency virus. So although some progress has been made towards achieving the Millennium Development Goals around the targets for TB, in terms of, for example, declining numbers of new cases and declining numbers of deaths, there are many that are off track. So, for example, of the 22 high-burden countries, 11 are not on track to reach their targets due to conflict, resource restraints, and also co-infection with HIV. And even in the UK, actually, rates were increasing from the sort of 1990s through to 2005. And they've kind of stabilised off now, but we still have 9,000 new cases a year in the UK, mostly in cities, and this is actually one of the worst rates for the Western Europe particularly. So there's plenty of work to be done. The rise of drug-resistant TB is also a cause for concern and has emerged as a major problem, and serious concerns, particularly around this, that the targets for diagnosis and treatment of multi-drug-resistant TB are even more off target. So it's estimated, in fact, in some countries where MDR-TB is more common, only 25% of people who are estimated, so 1/4 of people estimated to have it, MDR-TB, are actually getting diagnosed and treated. And there's plenty of efforts ongoing. We'll hear more about this afternoon in terms of the development of new drugs and vaccines to try and control TB. And whilst there are some limited success stories, probably there's not enough going on that's sufficient to really tackle this epidemic. And what we need is probably a more innovative, sort of thinking outside of the box approach to tackling the TB problem. And one of the questions that a number of us in the sort of global health group here have thought about is what's the difference between TB and HIV? When it comes to tackling TB, why doesn't TB get the same political attention, the same resource mobilisation, and the same funding as we've seen in HIV? In terms of the demographics, there are actually lots of similarities in terms of the populations that are affected, that the economically active age groups are affected, that in turn impacts on economical situations for the individual and also for countries. And in fact, the two diseases occur together. And indeed, HIV has largely been responsible for a lot of the recent increases in TB in the last couple of decades. And yet the global response to TB has been much less successful than the efforts to combat HIV/AIDS. And these are some of the issues that we'd like to examine in a bit more detail this afternoon. So the workshop's going to discuss the global threat of and response to TB in the light of potential lessons that we can learn from the HIV response. So that's kind of our theme. And I'm delighted to welcome our 4 speakers today who are going to throw light on various dimensions of TB during the course of the afternoon. And each speaker will speak for about 15 to 20 minutes. Now, if you have any burning questions pertaining to the particular talk, something like clarification of something factual, for example, then there'll be an opportunity to ask questions at the end of the talk. But otherwise, what we're going to do is save all the questions for the end and have a panel discussion. We've allowed plenty of time for this at the end of the speakers. So I'd like to introduce the 4 speakers now, and as I say, we'll go through the talks. Our first speaker will be Professor Ibrahim Abubakar. And he's a professor of infectious disease epidemiology at the Department of Infection and Population Health at University College London. And he's also involved with the MRC Clinical Trials Unit there. And he's co-director of the UCL Centre for Infectious Diseases Epidemiology and heads the TB section at the National Centre of Infectious Disease Surveillance and Control at Public Health England. So playing a very important senior role in the control of TB in the UK, and that's up at Colindale in London. He's qualified in medicine, general medicine, and specialised in public health, and did his academic public health training at the London School of Hygiene and Tropical Medicine, Cambridge, and the University of East Anglia. And in addition to advising the Department of Health on tuberculosis control, he runs his own programme of research on tuberculosis and other infectious diseases. And he's also a member of the WHO, the World Health Organization Global Task Force on TB impact measurement, and serves on several working groups within the European Centre for Disease Control and the World Health Organization. Dr. Grania Brigden is the TB advisor for Médecins Sans Frontières, their access campaign. So she's been based in Geneva now in Switzerland since 2011. Now she studied medicine in the University of Aberdeen in Scotland and worked as an NHS respiratory doctor specialising in TB. And then in 2007 and 8, she gained experience working for the VSO Voluntary Services Overseas, setting up a TB diagnostic and treatment service in Uganda. In a slum, particularly working in a slum area within Kampala. And she's a member of the steering committee of the Sentinel Project on Paediatric Drug-Resistant TB and is committed to improving TB treatment by increasing access to reliable diagnostics and quality treatment for patients with TB. Our third speaker will be Professor Stewart, who's the scientific coordinator of the More Medicines for TB Consortium and director of the Global Health Institute, as well as chair of microbiological pathogenesis at the School of Life Sciences at the École Polytechnique Fédérale de Lausanne in Switzerland. So Stewart studied biology initially at the University of Wales and then got his doctorate from the University of Sheffield before undertaking research first at the University of Umeå in Sweden and then the Max Planck Institute in Tübingen in Germany. And he then moved to the Institut Pasteur, where he was a senior research fellow, then head of the bacterial molecular genetics unit, director of strategic technologies, and then was in fact finally the Institute's scientific director. So Stewart's contribution towards the understanding of molecular genetics of important pathogens such as Mycobacterium tuberculosis, Mycobacterium leprae and the HIV, human immunodeficiency virus, is widely acclaimed throughout the world, and he was a leading member of the team of scientists that sequenced these pathogens. And he's been using this sort of the biological information that's been derived from this genomic sequence towards developing new drugs, vaccines and diagnostic tools for which he holds a number of patents as the inventor or co-inventor. And our final speaker this afternoon, we're pleased to welcome Dr. Al Story, who's the clinical lead for the Find and Treat service at University College London NHS Hospitals Foundation Trust. Now this organisation are a specialist outreach team that works alongside over 200 NHS and third sector frontline services to tackle TB among high-risk groups, including homeless people, drug or alcohol users and vulnerable migrants, people who've been in prison, whose lifestyles often mask the symptoms of TB and also provide challenges for them accessing treatment and diagnosis and for completing, as you know, the lengthy course of treatment that's required for tuberculosis. So it's a multidisciplinary team at Find and Treat, and they include former TB patients who work as peer advocates, TB nurse specialists, social and outreach workers, radiographers and expert technicians. And they take TB control into the community where they're finding active cases of TB to support treatment for patients and get them to finish their course of treatment. So that's all I'm going to say. Again, welcome. Thank you particularly to our speakers for trekking down to Sussex today. I think we're going to have a very exciting afternoon. And perhaps we could begin now with Professor Ibrahim Abubakar's talk, please. Thanks very much.